In the dimly lit corridors of Dr. Zhang's clinic, a sterile silence hung in the air like a veil of anticipation. The fluorescent lights above flickered softly, casting an eerie glow on the rows of vacant examination rooms. Dr. Zhang herself stood at the nurse's station, her eyes fixed intently on a single chart. Her name was embroidered on the crisp white coat that draped her slender frame, and beside it, in smaller letters, Pain Management Specialist. The soft beep of the monitors and the faint hum of the ventilation system were the only sounds breaking the stillness. Ava, one of the nurses, entered the room with a tray bearing a steaming cup of coffee. Her eyes darted nervously to Dr. Zhang's face before focusing on the chart in front of her. "You wanted to review the Thompson case again?" Ava asked, her voice barely above a whisper. Dr. Zhang nodded once, without looking up from the chart. The pages turned with a soft whoosh as she scanned them methodically, her brow furrowed in concentration. Ava set down the coffee and stepped back, watching her employer with an air of quiet deference. As Dr. Zhang continued to review the Thompson case file, Ava's gaze wandered around the room, taking in the neatly arranged rows of medication cabinets and the precise labeling on each shelf. It was a space where time stood still, every movement, every action, seemed choreographed for maximum efficiency. But beneath the surface of this orderliness, a faint unease simmered. The air in the room began to thicken with an almost imperceptible heaviness, like the approach of a low-pressure system. Dr. Zhang's eyes snapped up from the chart as if sensing something, but Ava didn't react, her face a mask of attentive calmness. The fluorescent lights above pulsed on, casting eerie shadows on the walls. "Dr. Zhang," Ava said softly, after an interminable pause. The doctor looked up, her expression unreadable behind a pair of wire-rimmed glasses perched on the end of her nose. "Yes," she replied in a voice that was almost, but not quite, steady. "I think you might want to see this," Ava said, her eyes flicking toward a monitor displaying a steady stream of vital signs from one of their patients, Thompson, or rather, patient 4721, the file name on which Dr. Zhang's gaze had fixed itself like a magnet. Dr. Zhang leaned forward, her elbows resting on the countertop as she scrutinized the readout with an intensity that bordered on obsession. Ava watched her employer with growing unease, sensing the quiet horror that coiled beneath the surface of this clinic's clinical facade. The machines beeped softly in the background, a staccato heartbeat punctuated by the occasional flicker of fluorescent light above. Dr. Zhang's face remained impassive as she absorbed the data streaming before her, but Ava saw something there, a glimmer of recognition that chilled her to her very core. In this place where time stood still, nothing was ever truly under control. And then the lights went out. The sudden darkness swallowed everything whole.